Reporter Michelle Rivard had the chance to visit the Concussion Center. Have a look.
Hi, it's Michelle Rivard for Daytime Toronto. I'm here at the Concussion Center, a one-of-a-kind medical facility in Toronto. Joining me is Medical Director of this center, Dr. Scott Clack. How are you doing today?
Good, Michelle. How are you?
I'm doing very well, thank you.
Great.
Let's start at the basics. What is a concussion?
Well, concussion is just where typically the head, sometimes can be the spine, but the head is injured, pushed into something basically, and the movement or the brain hitting the side of the skull creates essentially an injury. And then there are going to be responses of the body, the immune system, along the line of swelling. Sometimes, depending upon how hard it is, there can be bleeding. And so the actual concussion is the effects of that swelling and or bleeding on the brain.
And for someone who's recently suffered a concussion, what kind of symptoms should they be looking for?
I think the big one's going to be headache. That's going to be the most obvious one. Maybe there might be some mild visual changes, but those would be I think headache's going to be the most noticeable one.
And typically in the past, the treatment or the standard treatment for a concussion is just rest. Take it easy.
Right.
How has the Concussion Center changed that?
Well, a lot of people, particularly anybody in sports, athletes, one of the big things about an injury like that is it's going to slow down their training or it's going to slow down their participation in their sports. So they want to get back to things as quickly as possible. And if you just leave the brain to its own devices to heal itself, it's going to take time. And that's where the whole rest factor has come in, because generally it hasn't been thought that there has been anything available to be able to treat it. Here, what we've done, especially with all the discussion in the media over the last year or so about concussions in sport, we've been looking at the applications of different natural treatments, including hyperbaric oxygen therapy and different natural therapies, to be able to give those people that opportunity to get rid of their symptoms, speed up their healing, and then be able to get back to the things that they love to do.
So what you specialize here is in hyperbaric oxygen treatment.
Yes.
So you're going to show me how the session works.
Right.
Okay, and so what is a session like?
Okay, so we have a gentleman here who's had a little bit of a shoulder injury, if I remember correctly, and he's going to be using hyperbarics to treat that as well. So what we're going to do now is slide him into the chamber, and the whole point of the hyperbaric oxygen treatment is for the person to be exposed to usually increased oxygen higher than what we normally breathe, and in the case of the center we have here, they're going to be breathing 100% or pure oxygen. They're going to be breathing that while the chamber is pressurized. And the point of adding the pressure is to be able to drive the oxygen deeper into tissues, get a higher concentration into that, and then the actual effect of the oxygen is to be able to assist the body in healing the injury.
So what kind of oxygen do we breathe in on a daily basis? You said this is pure, but what are we breathing in right now?
Room temperature is basically 21% oxygen.
Oh, wow.
Okay, and interestingly, it will decrease as we go higher. So of course, we often hear stories about people doing climbing expeditions, dealing with oxygen deficiency. Well, we're going in the opposite direction. We're putting the oxygen in under pressure.
Oh, like going underwater?
Exactly.
Oh.
Yeah.
And now how does this treatment help speed up concussion?
So the oxygen is reducing inflammation. It's taking down the swelling, so that's going to take away some of the symptoms. It also modulates the immune system, so the immune system is going to more effectively repair the injury. If you think of the injury much like a scar on your arm, when it's been cut, you see the scab, and the immune system again works with that to heal that up. Well, we're doing the same thing internally, but we're allowing oxygen to help work with the immune system, modulate the immune system response, so that it can heal more effectively and get past some of the stages like the swelling stage.
And now, are there many centers like this in the area?
Not in Ontario that I'm aware of, not that certainly put any expertise. I've heard of centers in the United States that combine hyperbaric oxygen therapy with other treatments and doing it as a concussion treatment center.
Why do you think there are not any other hyperbaric centers in Ontario?
Well, the use of hyperbaric oxygen therapy is very limited in the overall practice of medicine. It's not what you would call a standard treatment. It is listed for wound healing for, say, people with diabetic ulcers. There are 12 other indications that it's known for, and those typically get taken care of in hospitals where hyperbaric oxygen equipment is available. But aside from that, newer applications are coming online, and that's where centers like this get a chance to provide services. And whether it's treating concussions, we treat children with autism here. We also help patients with multiple sclerosis, Parkinson's disease, Lyme disease. So there are new applications that we're learning hyperbaric oxygen therapy has an application for.
Very neat. And now the center was opened 2 years ago. The Concussion Center is new, but however, this center itself was opened 2 years ago by two local women. Why did they open the center? Well,
one of the women has a son who is on the autism spectrum. And Lorianne, the other woman who started the center, was working with hyperbarics already, and it was in their early experiences in finding out that hyperbarics would be helpful to autistic children that they decided another center would be necessary to make the services available to the kids to help them along. And of course, again, we're trying to grow the awareness and the knowledge that there are a variety of conditions like Parkinson's disease, MS, and Lyme disease where patients would benefit from hyperbaric oxygen therapy as well.
And do you have any stories of really positive experience that patients have had here at the center?
Well, there's a variety of stories to tell. There's certainly one gentleman who, interestingly enough, has Parkinson's disease, but he was treating along with his grandson because a lot of times the kids are a little nervous about being in the chamber. So when an adult or another child goes in with them, it allows the treatment to work. The gentleman with Parkinson's, the grandfather, also benefited from the treatment. He saw some changes with him. Many of our autistic kids, we have lots of great stories in their situations. Some kids will actually speak for the first time. Many times we do see improved cognitive function, better eye contact. So a lot of the attributes to autism that parents are really looking for changes, we do see those be able to come along.
And if someone's looking to get in contact with you, how can they do that?
Well, they can call the center, 416-789-HBOT, and they're calling Ontario HBOT. There's also our website, ontariohbot.ca. So those are the two easiest ways to contact us.
Awesome. Thank you so much for your time today, Dr. Clack.
Thank you.
Thank you. And now we rejoin the studio.